Hi, are you guys Donald's parents? Can you verify his name and date of birth for me? Okay, thank you. I am Serena. I'm a nurse that works here. I'm actually going to go over the medications that we are sending you home to administer for him. We have Ketofen for conjunctivitis, allergic conjunctivitis, and those are eye drops. And then we have ofloxacin, which are going to go in his ear, and then we have epinephrine for anaphylaxis. So we're going to go over epinephrine first. You're going to want to administer this to Donald as soon as you notice two different signs of anaphylaxis or getting to anaphylaxis. Face swelling, hives, any sort of coughing, swallowing, or clearing the throat a lot. Those are all signs that you should give epinephrine. And if you give epi, then you also need to call 911 afterwards. No matter what, you always should call 911 after you administer epi. So I brought this bear here to kind of show you guys how you're going to administer it. And this is a practice EpiPen. So you can administer this through clothes. A lot of people think you can't, but you can administer this straight through the clothes. You're going to flick the cap off, and that's going to bring down the needle. You won't necessarily be able to see the needle. It'll have an orange cap over it. And so you want to make sure that you steer clear of that. And then you would want to hold it to the leg, and you want to push as hard as you can until you can't see the orange anymore. And you just push, and you want to hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. And if you can't quite get to 10 seconds, that's understandable. He is a child, but you want to try to get to 10 seconds. And then, of course, immediately after that, you want to call 911. Some side effects. He may complain of having a racing heart. That is normal. It's a strange feeling, but again, if you give epi, you do need to call 911 because it's short acting, so he can start having the symptoms again, and if you don't have another EpiPen, that could be a huge issue. Alright, so let's go on to the Ketofen eye drops. For this, it's pretty simple. Doing it on a child is always a little difficult just because when you come at somebody at their eye with something, everybody's instinct is to close their eyes. So the best way to do it is, of course, to tell them everything you're doing as you do it. So you want to, of course, clean your hands before you go near them. And then you can either have them pull down on the conjunctiva, or you can take gauze or like a tissue and pull down. And then you're going to want to rest. And these are actually going to go in both eyes. So you're going to want to do, it looks like 2 drops in both eyes. And so they'll pull down on the conjunctiva, and then you'll rest your hand on their forehead, and about 1.5 inches to 3/4 inch away from the eye, you're going to drop the 2 drops in. Ask them to close their eye and just gently close their eye. You can wipe away any excess. And that is it. For the Otic drops, they are in both ears as well. And let me just check something real quick. What the world? Sorry, my internet went down. Okay. Alright. So, it's two drops in both ears for the eardrops as well. And so for this, again, clean your hands beforehand. You want to kind of inspect the ears beforehand just to make sure there's no wax or anything in there that's blocking it, because you really want that medication to get down there. So you're going to actually pull his ear up and out, pull super hard, just enough to like really open up that passageway, and have them turn their head to the side, and or have them laying on one side and then to do the other side. And you're gonna get close, and towards the back of the canal, you're gonna put 2 drops in, and then just kind of close it and massage it, and then have them lay on that side or keep their head tilted for 2 to 5 minutes, and then switch and do it on the other side as well. It looks like this is for an ear infection, so definitely follow up with us if you feel like his symptoms aren't getting better within a certain amount of time, okay? And you're going to do the eye drops and ear drops both twice a day at 8 o'clock, and then again at 8 o'clock again, 8 p.m. So 8 a.m. and 8 p.m. And then the epinephrine is just as needed when you see those symptoms, okay? And so now I'm going to ask you guys a few questions, just since we just taught you. What are some signs that you should administer epinephrine? Okay, so facial swelling, coughing, that's really good, that is true. And how long should you hold the EpiPen to your child's leg? 10 seconds, good. Let's talk about the eye drops now. About how far away should you hold the tip of the eye drops? Inch and a half inch to 3/4 inch. That's good. And for the eardrops, how should you pull the ear? Up and out. Perfect. All right. It sounds like you guys got it. If you have any more questions, then of course you can give us a call, come back in, anything along those lines, and we can definitely show you. And if you want us to teach Donald how to administer his EpiPen to himself as well, we can definitely do that. All right. You guys have a great day.